And good afternoon. My name is Dr. Raphael Fricks. I'm with the Department of Veterans Affairs National Artificial Intelligence Institute. Today, I wanted to highlight the AI tech sprint process, which is one of the ways the National AI Institute engages with outside partners, including small businesses, to put data in the hands of data scientists and improve veterans' care. First, a brief introduction to our institute. The National AI Institute, or NAI as we call it, is a recently established organization within the VA Office of Research and Development. We were established in 2019 during National Veteran and Military Families Month, which is every November. And the formation of the NAI was part of the VA's response to several initiatives across federal government to maintain leadership in AI. There were a series of executive orders and internal studies directing different federal agencies to approach the task of maintaining leadership in research and development and application, and as well as training of federal agencies to better use our AI capabilities. And one of the ways that the NAI achieves this goal is through our signature initiatives, such as the AI Tech Sprint. Tech sprints are an opportunity to engage rapidly with industry partners outside of the traditional contracting framework in a mutually beneficial manner. Essentially, it is a bit of a open challenge. We provide specially curated data as a bidirectional link between government and potential users so that they may develop AI tools to improve veterans' care. The VA Open Data Portal, which is a resource that I think needs more promotion, through the Office of Enterprise Integration, has provided a platform for distributing data that makes tech sprints feasible. So anybody right now can go and can navigate to the Open Data Portal and look through a variety of different data sets that are available through the VA. We use this data specifically to engage with industry partners who bring an innovative approach to problem solving, additional technical expertise in AI or machine learning, and experience in product development. In return, the organizations receive access to large data sources that are unique to the VA, as we'll touch on later, as well as veteran perspectives and access to top-notch clinicians for subject matter expertise. So we really try to pair and have sort of a two-way communication between our teams and our internal resources. And we look to establish ongoing collaborations and provide demo and funding opportunities throughout the sprint. So if you could go to the next slide, please. So why do organizations participate in the tech sprint, and why would we host one? Companies receive access to unique VA-created synthetic data through platforms such as the Open Data Portal. The data is used to develop a prototype with expert input and in line with VA needs, which is something that if a product is developed out in the open might not necessarily line up with the internal needs of our organization. And at the end, the NAI distributes a prize pool among the top recognized prototypes. However, and it's quite nice, but however, the real result is a process that identifies and tests products as a way to help us fast track potential contractual or piloting opportunities. The sprint is aimed as a precursor for these more traditional avenues but through the sprint, we can build evidence for a solution before either party engages in a larger, more highly involved bureaucratic process. The sprint is designed to be about a 3-month engagement, as opposed to a traditional contract may take, with the VA in particular, may take quite a while before any real motion happens. And we find that the agile sprint process facilitates our engagement with small businesses and startups who typically had a harder time bidding in a traditional contracting process or RFA or any of the larger avenues that may take, in some cases, like a year for a large organization to get through all the regulatory requirements that we have to enter that kind of agreement. In the tech sprint, we aim to also establish long-lasting collaborations by pairing teams of complementary talents within the VA. So for instance, we have a few organizations that are focused on a specific technology in a specific field of medical practice, while we look to find a clinician that's practicing in that field or perhaps has a research affiliation or has produced research along the lines of that technology. And oftentimes these communications can go far beyond the period of the sprint. And throughout, we hear from veterans to maintain a veteran-centric design process. so that really our mission to care for veterans is at the forefront of everything that we do. Overall, we find these sprints to be mutually beneficial opportunities to innovate veterans care and elevate our industry collaborations. And so if you could go to the next slide. Why might a small business in the healthcare space take interest in working with the VA? As we all know, data and data sharing enables the development of AI tools. The more data that we have typically with some of these methods, deep learning, for instance, comes to mind, reinforcement learning, convolutional networks, and so on, typically the better result that we can get as we expand the training pool, add more cases, have more examples. As the largest healthcare system in the United States, the VA contains an ocean of data. And we have here a couple summaries. So for instance, the VA sees over 9 million patients. Last I heard, actually, this might be closer to 11 million patients are VA eligible. Over 120,000 doctors and nurses are providers within the VA, and roughly 75% of all US doctors and nurses have some form of training with VA hospitals. But in addition to the people involved in our practice, we have over 1,200 medical facilities across 50 states and US territories. Through all of this practice, we have collected over 10 billion medical images, which are currently, stored away in several different portions of the VA, with an estimated 1 billion more images per year. Now, if you consider that in comparison to what is publicly available at a different, like for instance, the NIH repository, we are lucky sometimes in research if we can get a set of 1,000 images. And additionally, some of the care that we provide at the VAs is out of reach for certain systems, for certain healthcare practices. So for instance, we do also have multiple genomic screenings, genomic donations. And really, I want to highlight too, since the advent of the coronavirus pandemic, we have really escalated the number of telehealth episodes. Really, many services have moved to telehealth. So these numbers that we have here are from, I think, before the pandemic started. So this is, increased astronomically since then. But it's easy to get excited about the data. However, we must always consider the potentially sensitive nature of all this information as we pursue different topics. So there are a number of different ways that we look to de-identify data to make externally available. Most of it is internally available to our collaborators. I've mentioned throughout this presentation the term synthetic data. Researchers within the VA are developing methods to generate synthetic patient data that is representative of the VA population and all of these figures that you see here. These methods generate a set of records that capture statistical properties of the events that may occur in a patient's health history without representing any specific real patient. And that removes the privacy concerns that would exist with sharing even de-identified healthcare data with some trade-offs. So for small businesses, in addition to the TechSprint, I encourage you to look into the Open Data Portal, where some of the synthetic data will be available. And there are also many synthetic data projects that are being opened. But on the next slide, let me just cover again the TechSprint process. So for more information on the TechSprint process overall, please see our website here with the National AI Institute. Typically, our postings go through the challenge.gov posting website that's run by GSA, I believe. We have a TechSprint that is currently underway now. We're about halfway through the process, so it's too late to join the current one, but we look to offer these periodically about once a year. And also you can see results of these past TechSprints through our publications with, for instance, the VA Vantage blog and a couple different articles and even TV interviews with the director of the National AI Institute. And I'm happy to share any of that information for anybody that's interested or if there's any questions.